Elizabeth Hicks. Please proceed.
Thank you so much, Chair. Hello, and Chair and members of the Public Health Committee. My name is Elizabeth Hicks. I'm the U.S. Affairs Analyst at the Consumer Choice Center, which is a global think tank advocating on behalf of consumers. And I want to thank this committee for their time. Simply put, Bill 6488 will do more harm than good if passed. Enacting a flavor ban on vaping products will push adult consumers to switch back to smoking combustible tobacco. Sadly, 4,900 citizens of Connecticut lose their lives to smoking-related illnesses every year. Considering that studies have shown vaping to be 95% less harmful than smoking, ensuring that adult consumers have access to the vaping products they prefer will ultimately lead to fewer cigarette smoking-related deaths within Connecticut. As Senator Anwar and Senator Gordon know through their work outside of this legislative body as medical doctors, smoking-related illnesses are very serious and can lead to cancer. After being around secondhand smoke for most of my life due to family members smoking cigarettes, this past year I unfortunately received my very own cancer diagnosis, undergoing 12 rounds of chemotherapy, 20 sessions of radiation, 9 cycles of immunotherapy, and multiple surgeries. And I can assure you that I would not wish this on anyone. Considering that this committee is focused on protecting public health, embracing vaping as a harm reduction tool here in Connecticut will help ensure that your citizens are much less likely to end up in a situation similar to mine. It's estimated that about 6% of Connecticut's adult population uses vaping products, accounting for over 200,000 citizens throughout your districts who have switched to a less risky alternative to combustible tobacco. Banning flavored vaping products will encourage these former smokers to switch back to smoking cigarettes, which are already costing Connecticut's taxpayers over $520 million annually just through Medicaid expenses alone. If a flavor ban is enacted in Connecticut, then consumers will likely look towards the illicit market in order to get access to their preferred flavored vaping products, where product regulations and standards are not enforced. Pushing consumers to the illicit market through a flavor ban will also be to the detriment of vape shops throughout the state, as many of their products will no longer be available. It's also worth noting that, unlike vape shops, the illicit market does not abide by age restrictions, therefore making it much easier for youth to acquire these products illegally. I very much appreciate that this bill is well-intentioned, but it's important that we look at the evidence showing just how misguided flavor bans are. If this committee wishes to protect public health within Connecticut, then I strongly encourage you to reject this bill. Thank you again so much for your time, and I'm happy to answer any questions you may have.
Thank you, Ms. Hicks, and I'm sorry to hear about all that you have been through. I have one question for you, and I do see that we have a question from Representative Welander. You said you are with the U.S. Choice Center, is that right?
The Consumer Choice Center.
Consumer Choice Center, forgive me. And where are you located? Can you tell us a little bit about that organization?
Yes, so our organization is located in Washington, D.C. I personally am located in Lansing, Michigan. As I stated in the beginning, we are a global think tank focusing on consumer issues and representing consumers throughout the globe. I personally focus on issues that pertain to the United States.
Thank you. And Representative Welander.
Thank you, Madam Chair. I apologize, I'm in my car listening right now. First, I wanted to just also extend my, I'm happy that you were doing better, that you are healthy, or healthier now and on the road to recovery. I'm sorry you've had these health troubles. But I wanted to address a couple of points that you made in your testimony and just say clearly, I feel it's quite irresponsible to try and present vaping as a harmless activity. We all have seen the studies. We all know that tobacco use and combustible smoking is incredibly dangerous and unhealthy for those who participate, but also those who are around, as you unfortunately have found through secondhand exposure. But I do not think that we can, as a public health committee or just responsible adults, present this as vaping being a healthy alternative in any way. So before we move forward in having this discussion, I think we need to be really honest and real about these discussions. So thank you so much for your time, Madam Chair.
Am I allowed to respond?
Thank you, Representative Welander, and yes, you may, Ms. Hicks.
Thank you. And thank you for your both of you for your kind words and for the question. I agree with you that, vaping is not a healthy option, but what we're saying is it is a harm reduction tool. It is significantly less risky than smoking combustible tobacco. There's been a meta-analysis done by Public Health England that has shown that vaping is 95% less harmful. There's still that 5% risk, but in comparison to smoking combustible cigarettes, it is a much better alternative. And again, as you guys are trying to protect public health here, there are many people within your state who are addicted to nicotine and addicted to cigarettes. In order to give them, using this nice innovation tool to be able to get them off of, again, this very harmful thing that is combustible cigarettes, and providing them with something that is less risky, I think is definitely a step in the right direction and would be a win overall for public health.
I appreciate those
Thank you.
comments. Oh, Madam Chair, I'm sorry, may I
Yep,
follow up?
no, you may. You still have the floor, Representative.
Thank you, Madam Chair. I appreciate those comments, but I do think that if we are going to be talking about smoking cessation tools, then we should be looking at proven methods that actually do help people stop this harmful habit, and rather than trying to portray a practice that still involves an inhalation of chemicals and often addictive substances. So if we are going to have this type of conversation, I think, again, we need to be clear about it, and that vaping is a newer practice. It is shown to be incredibly addictive, especially in young people, and has shown to have a very, indeed, harmful impact, on their health. And just the way that combustible smoking was dismissed as a healthy alternative for different things back in the day, I think that as time moves forward and we see more science rather than just one study, we will see that vaping is a harmful action. So I just want to make those comments and make my point heard. And I appreciate the time, Madam Chair. Thank you.
Thank you, Representative Wielander. Representative Denning.
Thank you, Chair McCarthy-Vahey. Elizabeth Hicks, thank you for your testimony. You said, and just clarify for me, that if we do away with these flavored products, that people will go back to smoking. Do you have any statistics, or where did you get the science on that? And if so, aren't people just going for flavor and not the tar and nicotine that comes? I just have never read anything in any research journal that proves that, and I'm just looking for any data that you might have.
Yes, I thank you so much for that question. First of all, in my written testimony, you will find a lot more links to data and studies. I know there's been a lot that has been articulated throughout this hearing. It's been a long day, so I don't want to bore you guys with more data points and more studies. But yes, there are studies that do show that where flavors have been banned, smoking increases, smoking cigarettes increases. And I think this point was made earlier, but I think it's worth reiterating. Those that are looking to stop smoking cigarettes, I mean, that should be very much encouraged instead of smoking combustible cigarettes.
Thank you very much. I will check out your written report.
Thank you.
Thank you, Representative Denning. All right, seeing no further comments or questions, thank you, Ms. Hicks, for your testimony before us today, and have a wonderful evening. I'm going to go